They are moments of pure joy, sometimes taken for granted.
I love you, don't leave me.
The things we say to each other, the love so obvious and clear.
Yes, Liz. Yes, Liz.
But for two local families, sudden, unexpected, and deadly emergencies almost took these simple things away and changed their lives forever.
Yay, bubbles.
And I just kind of knew that he was dying.
I just cried all the time. All the time. I still cry sometimes.
But they were tragedies prevented thanks to the simple-looking machine and the special skills of the people at UF Health. A combination of years of planning, precise timing, and in some ways chance that literally saved the lives of Dr. Luis Rios, a UF Health physician, and Brandon Taylor, the first patient ever treated here using this device called ECMO.
Yeah, that's perfect timing and on their end and my end. Like I said, if it was a week earlier, I'm going.
What scared me the most is they were like, we've never done it before here at this hospital. We've done it, we're gonna bring somebody in from Gainesville, but when it's your last option, what do you do? I mean, it's the only option that you have left.
Dr. Schreiber and I would be rounding on patients in the ICU and seeing patients in our trauma resuscitation unit, and we thought, wow, these patients could be saved by critical care technology such as ECMO, which is extracorporeal membrane oxygenation. It supports the lungs, the heart, or the heart and lungs.
These patients were dying, and there were a lot of young patients who were in trauma, 20, 30, 40-year-olds, and they felt helpless to do so. So they started looking at how they could help these patients and started the idea of they wanting an ECMO program.
When a patient gets that sick, sometimes we couldn't find any other institution, not only in Jacksonville it didn't exist, but sometimes around the whole state of Florida that would be able to help us and rescue that patient. And so we realized that if no one else was able to do it, then we were going to have to develop the ability to do that ourselves here to really save these patients' lives.
Anything like this, which is truly a new program within a already established healthcare system, took many, many years.
Years in the making, but just in time for Taylor.
So if I would have gotten that wreck a week earlier, I'm dead right now.
On his way to work on a foggy morning in Kingsland, Georgia, Brandon hit a log truck making a wide turn. He doesn't remember any of it, but his wife Brittany does. She got the call and realized just how serious it was when she got to UF Health, where Brandon was being treated.
And I remember walking through the trauma bay and I was walking and had to stop because I felt something on the bottom of my shoes and there was glass everywhere. I guess it was just a mess.
A long list of injuries, multiple broken bones, and a dangerous brain bleed. It was a combination of trauma so serious that Brandon almost died.
Now, I want to say July the 5th is the day that they came in and was like, look, he's not gonna make it through the night.
But he did make it because of ECMO, which had just been given the go-ahead to start accepting patients literally just a few days before Brandon needed it.
It ultimately saved his life. That was literally our last option. There was no more life support that he could be put on. He was on life support 100% and it wasn't working.
To know Brandon's alive today because of the therapies we offer at UF Health.
Look at her smile.
It's amazing to be a father for his 2 kids and a husband to his amazing wife. That's just a testament of the care that we provide here.
A year and a half later, the ECMO program, now a major part of UF Health, saved someone near and dear to the organization. Luis Rios is a beloved physician in the emergency room, always upbeat, fighting to save so many, and he was in desperate need himself in December 2018.
We think he maybe had a viral thing first.
I was taking an immunomodulator for the asthma at the time. That predisposes you to viral illness.
It must have happened
Within
overnight
hours,
too,
yeah.
I think. He was in septic shock. It was a perfect storm.
Out of the blue, with literally no warning, Dr. Rios found himself fighting for life due to a massive infection. His wife says he was on the edge of death. And Melanie Rios should know she spent much of her career as a critical care nurse.
At midnight, I called his family and said, you need to come in because he's dying. I called my son in New York City and said, you need to fly home because Dad's dying.
It had happened in just a few hours. Desperate for a cure, someone recalled a presentation Dr. Schreiber had given, something called ECMO.
Love you, baby.
We were on night call together 24 hours before he got critically ill. And he was fine. He's a great guy, great physician. He's like a father figure to us all. We left that day. 24 hours later, we got a call from a referring hospital around where he lives that he was severely ill.
Dr. Rios was so sick, so fragile, that it took flight paramedics hours just to get him ready to fly.
Have a safe flight, Memo.
And when he arrived at UF Health, he was rushed to trauma ICU, where ECMO was waiting.
Oh, they got him on it within 18 minutes. The paramedics just brought him in on their stretcher in the room, and they just did it right there.
And they maxed out every therapy he could be on, except one, and the one we offer here.
After you get beyond the initial shock of, oh my God, it's Louis, you know, that sort of, you're kind of down to business into the clinical aspects of taking care of him.
It didn't take long to see the results. Melanie says the discoloration in his chest was nearly gone the next day. His breathing was better. His vitals, which were crashing only the day before, they were stable. There is no doubt the caregivers at UF Health are the reason he's still here.
Every day, even when I'm not at work, I think of them, and you know, that they're my family. You know, they forever will be ingrained in my mind as
they saved his life.
Brought me back.
Right.
Daddy the favorite. Daddy my favorite.
They are two different families from two different parts of our community. But like so many others, they now share an unbreakable bond with UF Health, patients, and the people who care for them. And in their case, the people who saved their lives.
They literally treat you like family. They don't treat you like patients. Like you'd be crying, they'll come up and comfort you. It's like, yeah, they were his doctor, but they were all of our family when we were there.
Have a great first day back to work.
But every time I see him in the hall here, he gives me a hug, and it's like there's this emotional connection that, you know, this bond that's kind of hard to describe.
This is therapy.
To see him up and around, not just up and around, back obviously in great health, working, full of energy as he was before, yes, it's really a testimony to the program.
They saved his life, and I'm glad he worked here. And love all of them.
I don't know what else to say other than thank you. Like what else more can you say?
I would hope that anyone in dire need of medical and surgical help can be presented with what I was presented with. They pulled me out of death and brought me back to life. And UF Health.
Yeah, Love you.
Love you too.
Is a godsend for this community.